A 73-year-old man was found dead in his bed one morning, not from a heart attack, not from a stroke, but from something far more unexpected, a morning masturbation that went terribly wrong. His body gave out during what should have been a private moment of release. No warning, no second chance, just silence. Now, this isn't a freak accident, it's a warning, a signal that many older men are ignoring often until it's too late. Hi, I'm Dr. James Carter, board-certified urologist and men's health specialist. For over 30 years, I've helped men over 60 stay strong, sexually healthy, and confident, not just in the clinic, but in life. And today, I'm here to talk about something most people never will. Because while masturbation is natural, even healthy doing it wrong, especially in the morning, can silently weaken your heart, damage your prostate, and leave you emotionally depleted. In this video, I'll walk you through 7 dangerous mistakes older men make when masturbating in the morning. Some of them you're doing without even realizing it. Others you might think are harmless, but they're slowly draining your energy and long-term vitality. And mistake number 4, it's the one I see almost every single patient over 60 make. It leads to infections, prostate flare-ups, and avoidable pain, and it's totally preventable. So if you care about your health, your strength, and keeping your body working the way it's meant to stay with me, this video isn't about shame. It's about awareness, and more importantly, it's about giving you the tools to protect what matters most: your health, your confidence, and your quality of life. If you're ready to feel better, think clearer, and reclaim the energy you thought was gone, this is where we start. Let's dive into the first and most overlooked mistake older men make in the morning. Let me ask you something. When you wake up in the morning with an erection, what's the first thing you do? If your answer is, well, I take care of it right away, you're not alone. In fact, this is one of the most common morning habits among older men, but it's also one of the most dangerous. You see, your body isn't fully awake the moment your eyes open. During sleep, your heart rate and blood pressure naturally drop to give your cardiovascular system a rest. That's a good thing. But when you go straight from rest to intense stimulation, especially sexual, you're putting your system under sudden strain. It's like slamming your foot on the gas while the engine is still warming up. I've seen this mistake play out in subtle and serious ways. Some men experience dizziness. Others feel a tightness in their chest. And in rare but very real cases, I've had patients suffer mini-strokes or heart arrhythmias after sudden morning arousal. What's more, this isn't just about your heart. Your nervous system is involved too. When you rush into climax before your body has fully transitioned out of its sleep state, you get a dopamine spike followed by a crash. That crash can leave you feeling flat, foggy, or emotionally low for the rest of the day. And for men over 60, that matters a lot. As you age, your body becomes more sensitive to stress and fluctuations. What you could handle at 30 with ease may now leave you feeling drained, or worse, trigger real health problems. So what should you do instead? It's simple. Give your body time. Take 20 to 30 minutes after waking before engaging in any sexual activity. Drink a glass of water, stretch, or take a short walk around the house. Let your blood pressure normalize. Give your nervous system a moment to reboot. By doing this, you're not only protecting your heart, you're setting yourself up for a more balanced, enjoyable experience. You'll feel more present, more relaxed, and less like your body is being thrown into chaos. This one shift in timing can transform your morning routine from risky to rejuvenating. Now, even if you get your timing right, there's another habit that could be silently hijacking your brain, and it starts with what's on your screen. Let's move on to mistake number 2, using porn. That overstimulates the brain. Let's talk about what most men don't like to admit, especially not out loud. You wake up, you feel aroused, and without thinking twice, you reach for your phone or tablet. You open a site, click a video, and just like that, your brain is flooded with flashing images, fast cuts, loud sounds, and endless stimulation. It feels exciting in the moment. But here's the truth. I wish more older men understood. Your brain wasn't built for that level of intensity, especially not first thing in the morning. When you expose your brain to high-speed, high-definition, digitally enhanced pornography, it releases a massive surge of dopamine that's the brain's reward and motivation chemical. But the problem is, your brain builds tolerance fast. The more you consume this type of content, the less responsive your brain becomes. You need more and more extreme videos just to feel a similar spark. And eventually, real life, real intimacy, real connection starts to feel flat. This isn't just about what's happening in the moment. It's about what happens after. I've had men come into my office and say, I just don't feel anything anymore. Not with my wife, not even with myself. They feel numb, disconnected, emotionally empty. And when we dig into their habits, morning porn is often the root. The brain, especially after 60, becomes less adaptable. It takes longer to recover from overstimulation. You don't bounce back like you used to. The more you wire yourself to respond only to hyperstimulation, the more you weaken your response to reality, touch, smell, emotion, presence. This kind of porn doesn't just affect your sexual performance, it affects your mental health too. Some men describe an emotional crash around midday, a sense of fog, lack of motivation, even sadness or regret. And they never make the connection to what they watched that morning. So what can you do instead? Start small. Turn off the screen. Instead, use memory, imagination, or physical sensation. Reconnect with the emotional and sensual parts of the experience, not just the visual overload. You'll feel more grounded. And over time, you'll retrain your brain to respond to natural cues again, something that's critical to healthy aging and emotional well-being. Your brain is your most powerful sex organ. Protect it. But even if you stop overstimulating it, the next mistake may be happening in your body itself at the very moment of climax. And most men have no idea it's putting their health at serious risk. Let's move into mistake number 3. Let's get honest for a second. What does your body actually do during climax? For a lot of men, especially over 60, the answer is they tense up. Muscles tighten, the jaw clenches, and more often than not, they hold their breath without even realizing it. This might seem harmless, just part of the intensity, right? But medically speaking, it's anything but harmless. What you're doing is something called the Valsalva maneuver, a fancy term for forcefully holding your breath while straining, like when you're lifting something heavy or pushing during a bowel movement. And during masturbation, especially at climax, this maneuver sends your body into sudden and dangerous internal pressure. Here's what happens. Your chest tightens. Your blood vessels constrict. Your blood pressure spikes. Oxygen to your brain momentarily drops. In younger men, the body might absorb this shock. But over 60, it can be a ticking time bomb. I've seen it firsthand. Mini strokes, sudden fainting spells, blurred vision, even irregular heart rhythms, all triggered by what should have been a normal, healthy release. And it's not just the immediate risks. Over time, this repeated straining can damage your vascular system, weaken your pelvic floor muscles, leading to leakage or erectile issues, compress nerves causing tingling, numbness, or loss of sensation. One man I treated had been quietly struggling with numbness in his groin for years. Tests came back clear. But when we talked through his habits, it turned out he'd been tensing and holding his breath so hard during every climax that he was slowly cutting off his own circulation and nerve response every single morning. He never connected the dots. The good news. This is one of the easiest things to change once you're aware of it. Here's how: focus on your breath during self-pleasure. Keep your jaw and abdomen relaxed. Let the experience build, not explode. Think softness and release, not effort and force. Climax is supposed to be a letting go, not a physical battle. And here's the beautiful part. When you breathe, when you let your body flow instead of fight, the experience actually becomes more pleasurable, not less. Your nervous system stays calm, your heart stays steady, and your energy stays with you through the day. If you've been gripping or holding your breath without realizing it, now's the time to shift. But even if you breathe right, there's still a hidden hygiene habit most men skip, and it's quietly setting them up for infections and prostate issues. Let's move into mistake number 4. This one might sound simple, too simple to matter. But as a urologist who has treated thousands of men over 60, I can tell you with complete confidence this small oversight can lead to big problems. Let me explain. When you masturbate, especially in the morning, most men don't think twice about whether they've gone to the bathroom before or after. It seems trivial. After all, what difference could a quick trip to the toilet make? The answer, a lot. You see, during sleep, your bladder fills with highly concentrated urine. It sits in your system for hours. And when you stimulate your body first thing in the morning, before flushing that system out, you create a situation where urine, semen, and pressure are all competing in a sensitive space. This is especially risky for men with even mild prostate enlargement, which is incredibly common after 60. Here's what can happen. The bladder doesn't empty completely. Pressure builds in the urethra. Irritation increases. Bacteria multiply. And if you skip urinating after climax, it's even worse. You leave residual semen and bacteria lingering in the urinary tract. It's the perfect breeding ground for infections, some of which can become chronic, painful, and extremely hard to treat. I've had countless patients come in with recurring urinary tract infections, burning or pressure when urinating, a feeling of incomplete emptying, growing discomfort they couldn't explain. When we dig into their routine, one thing often stands out. They weren't urinating before or after sex or masturbation. They skipped it out of habit, laziness, or because no one ever told them it mattered. But it does. Especially for older men, where prostate inflammation can flare up from even small irritations. In some cases, this leads to prostatitis, a painful, persistent condition that affects your ability to urinate, your sexual performance, and even your quality of life. So what should you do? It's simple. Urinating before clears the urethra and reduces pressure on the bladder. Urinating after flushes out any remaining semen bacteria or irritants. It's a quick, private, no-cost prevention step that can save you months of pain and doctor visits. And here's the thing, most men don't skip this because they're careless. They skip it because no one ever told them it mattered. Well, now you know. And once you know, you can do better. If you've never made peeing part of your routine, this is your sign to start. But even with perfect hygiene, there's still a damaging habit most men fall into. One that harms your body, not from the inside, but from the outside. Let's move on to mistake number 5. Here's something no one ever teaches men until it's too late. The way you touch yourself matters. Not just that you do it, but how you do it. And for many older men, especially those over 60, there's a hidden danger in the way they've been handling themselves for decades, too much pressure and too much force. Now, I get it. Over time, as sensitivity decreases and arousal takes longer, many men subconsciously start using tighter grips, rougher strokes, and more aggressive movements just to feel something. But here's what they don't realize. What feels normal in the moment may actually be causing microtrauma to one of the most delicate areas of the male body. As you age, the skin of the penis becomes thinner, blood vessels more fragile, and nerve endings less resilient. Add aggressive movement on top of that, and you're doing real damage. Let me tell you what I've seen in my clinic. Men who come in with loss of sensation and think it's just aging. Men who struggle to climax or can't maintain arousal because their nerves are no longer firing properly. Some even develop Peyronie's disease, a painful condition where scar tissue builds up inside the shaft, causing curvature and erectile dysfunction. And they're shocked when I ask them, have you been using a really tight grip or fast motion when masturbating? They usually pause and then admit, yeah, I guess I have. Because no one ever told them this matters. Here's the science. The penis has a complex system of nerve fibers, capillaries, and connective tissue. Repeated trauma, especially from harsh friction, causes inflammation, which in turn leads to tissue damage and nerve desensitization. Over time, you need more and more stimulation and feel less and less. It's a slow, silent process, but by the time symptoms appear, the damage has often been building for years. So what can you do? Simple changes. Use a gentler grip. You're not trying to win a wrestling match. Slow down. Give your body time to build sensation naturally. Consider using lubrication. It reduces friction and protects delicate tissue. Pay attention to what feels good, not what gets it done fastest. Think of it this way. You wouldn't brush your teeth by scrubbing with sandpaper. Why treat your most sensitive organ any less carefully? The goal isn't just climax. It's connection. It's protecting your ability to feel pleasure, not just now, but for years to come. If you've been using force out of habit, try gentleness instead. You may be surprised by what you gain. But even if your technique is perfect, there's still a silent mistake many men make, one that doesn't start in the body, but in the heart and mind. Let's move into mistake number 6. Let's step away from the physical for a moment. Because as much as your body matters, your emotional state, what's going on in your heart and mind, has just as much impact on your health, especially after 60. Now I want to ask you an honest question. Have you ever found yourself masturbating not out of desire, but out of boredom, sadness, or loneliness? You're not alone. Many older men tell me they reach for release when they're feeling disconnected, anxious, or simply overwhelmed by the quiet moments of the day. It feels like a quick fix, a fast way to feel something. But here's the problem. When you engage in sexual release from a place of emotional emptiness, the pleasure you get is short-lived, and the crash that follows can be heavy. Here's what's happening in your brain. You stimulate your reward system with a hit of dopamine, that feel-good chemical. But because there's no emotional connection, no real intimacy, your brain gets the chemical high without the deeper satisfaction. The result, a temporary feeling of relief, followed by a drop in mood energy and motivation. Some men describe this as a strange kind of fog, or even a subtle sadness that creeps in afterward. They say, I thought it would help me feel better, but afterward, I felt even more alone. This isn't weakness, it's biology. When you're emotionally low, your brain is already struggling to regulate chemicals like serotonin and oxytocin, both essential for mood and connection. Using masturbation as a coping mechanism only masks the imbalance and over time can deepen it. Even worse, it can create a loop. You feel down, you seek relief through release. You get a brief high, followed by a crash. The crash leaves you feeling lower, and the cycle repeats. Over months or years, this pattern can lead to a numbness, to joy, reduced motivation, and even signs of mild depression. So what's the solution? It's not about giving up pleasure. It's about changing the reason behind it. Before you reach for that moment of release, ask yourself, am I doing this from a place of connection, relaxation, or gratitude? Or am I doing this to avoid a feeling I don't want to sit with? If it's the second, pause. Take a walk. Call a friend. Do some deep breathing. Even 5 minutes of emotional grounding can shift your state dramatically. And when you do choose to engage, let it come from a place of self-respect, not self-soothing. Because when pleasure is tied to emotional health, it uplifts you, it energizes you, it brings you back to life. So if you've ever felt that post-release emptiness, don't ignore it, listen to it. But even if you're emotionally grounded, there's one more mistake many men make, and it happens when they ignore the early signals their body is trying to send. Let's move into mistake number 7. Now we come to the final mistake, and in many ways it may be the most dangerous one of all. Because this one isn't about what you do, it's about what you ignore. Let me explain. Over the years, I've met so many men who walk into my office and say things like, Doc, I just don't feel the same down there anymore. I've been noticing some tingling, or maybe numbness, but I figured it's just age. Sometimes I feel pressure in my groin after I finish, but it goes away. These are not just normal parts of aging, they're messages. Quiet, subtle messages your body is trying to send you. and too often we ignore them. We chalk them up to being over 60. We brush them aside as no big deal. We wait until those quiet signals become pain dysfunction or even disease. Here are some of the most common early warning signs that get overlooked. A burning sensation when urinating, groin pressure after ejaculation, delayed or weak orgasms, numbness or tingling around the pelvic area, sudden changes in erection quality or sensitivity. These are your body's check engine lights. They're telling you something's off, whether it's inflammation in the prostate nerve compression circulation issues or urinary dysfunction. And the tragedy is most of these issues are treatable if caught early. But the longer you wait, the harder they are to fix. Some nerve damage can become permanent, some infections can become chronic, and some emotional damage caused by long-term frustration and disconnection can take a real toll on your confidence and well-being. I've seen men wait years before getting checked, only to find out that what started as a simple inflammation had developed into something far more serious. Here's the truth: your body always speaks. The question is, are you listening? So what should you do? Pay attention to how your body feels before, during, and after sexual activity. If something feels off, different, or unusual, write it down. Don't assume it's just your age. And please don't wait until it gets worse. Make an appointment. Ask questions. Have a conversation with your doctor, even if it feels a little awkward, because that 20-minute conversation could save you from months or years of unnecessary suffering. You've come this far in life by trusting your instincts. Don't start ignoring them now. If you've noticed any of these signs, even the small ones, don't push them aside. Your body is asking for your attention, and it deserves it. Now that you know these 7 mistakes, it's time to bring everything together. Let's move into the conclusion: how to turn awareness into action. If you've made it this far, I want to thank you not just for watching, but for caring. Caring enough to pay attention to something most men never talk about. Caring enough to reflect on your habits. And most importantly, caring enough to protect your future. Because here's the truth: masturbation is not the problem. In fact, when done mindfully, it can support your circulation, your prostate health, your hormones, your mood, and your connection to your own body. But the 7 mistakes we've walked through together today, those are the real issues. Rushing the act before your body is ready. Overstimulating your brain with porn. Straining and holding your breath at climax. Skipping the bathroom before or after. Using excessive pressure or rough techniques. Seeking pleasure from a place of sadness or stress. And most of all, ignoring the quiet signs your body is trying to send you. These aren't just small errors. They're quiet, cumulative threats. Threats to your heart, to your nervous system, to your sexual vitality, and to your sense of self-worth as a man. I've worked with men in their 60s, 70s, even 80s who believed they were too old to change, too far gone to heal. But the reality is, when they started listening, learning, and applying just a few of these changes, everything shifted. They felt more energized in the morning. They regained confidence in their body, and for many, the fog of disconnection and fatigue lifted. They started feeling like themselves again. That's what this is really about. Not just sex, not just health. This is about taking back your vitality, your sense of control, your ability to enjoy life fully and deeply, without shame, without fear, and without damage, quietly building in the background. So here's my encouragement to you. Don't just watch this and move on. Pick one thing you learned today and apply it starting tomorrow. Maybe it's pausing before you act in the morning. Maybe it's letting go of the screen. Maybe it's checking in with your emotions first, or finally calling your doctor about that nagging symptom you've been ignoring. You don't have to fix everything all at once, but one small shift, practiced consistently, can change your health, your mood, and your life. Because this isn't the end. This is the beginning. In the next episode, I'll show you the simple morning routine I recommend to my older male patients, designed to support your heart, your hormones, and your sexual vitality every day. Make sure you're subscribed, turn on notifications, and share this with someone you care about. Your best years aren't behind you, they're still waiting. Let's walk into them together.